I got coronavirus. Now, before I dive deep into my coronavirus stage, today is January 18th, 2021. There are 95 million cases worldwide today and over 2 million deaths. Now, let's go into this COVID-19 situation I had. So, the last video you watched, I filmed it actually on January 9th, not January 10th. That's how disoriented I was from COVID because it was giving me like mini migraines, mini headaches. I just had mini headaches all the time. Felt like I had a cold, felt like I had allergies to nothing. It was strange, it was weird, but I had it. I tested positive. I start the new year by having COVID-19. And on top of that, they completely shut down the whole province with a stay-at-home order till February 19th anyways. So basically the only thing you're allowed to do is to go to work, but I can't even go to work because I'm sick. And that's how it goes. Now, how did I get COVID? Well, I have a hunch. Basically, what happened was my coworker tested positive for COVID-19, but I didn't know he had it at the time. We worked together on January 3rd, 2021. That was the last time I saw him. January 4th, he calls in sick. He's like, I can't get out of bed. I can't move. I'm fucking got chills. I can't fucking do nothing. I'm just a sitting duck in bed. I'm like, okay, that's interesting. Oh, just overnight like that. And I was like, okay, whatever. I was still feeling fine. Around January 6th, like the Wednesday, my throat started getting dry on me. Started having like a cough and a congested nose, and I was taking throat lozenges, like Halls and shit. Started taking cold and flu pills because I just thought I got a cold. I was still able to drive to work. I was still able to go to work. So on January 6th, I started feeling weird. Fast forward to January 10th is when he gets his results for his COVID-19 test. So that is 7 days later. So the last time I saw him was January 3rd. He calls in sick January 4th. He books a test on the Thursday, which I believe is the 7th or the 8th of January. Then he gets his results on the 10th. He comes back positive. So I tell my boss, I am not coming into work. I definitely have it. If he has it, I have it. Because me and him work literally side by side 24/7 at work. So I'm just like, okay, I'm going to go get tested. So then on January 10th, I'm like, I'm done with work. I'm taking hiatus for 2 weeks. That's it. I'm gone. I'm disappearing for 2 weeks. I need to not get anyone else sick. So I booked the test. I take the test on January 14th. I go to the hospital. Literally 5 minutes, in and out. They stick the stick up your fucking nose. And you do the test. And then, on January 15th, it says I'm positive. And now, we're in a dilemma. Today is January 18th. The hospital told me that because I last had contact with my coworker who had COVID on January 3rd, after January 17th, if I don't have any symptoms or anything, then I'm free to go and roam. Free to go and roam. There's also another dilemma where they said Niagara Health or the public health, whatever health system in my area is supposed to call you when you test positive. But I believe that because there's been so many positive tests, they don't even have time to call you. Like, I got tested on January 15th. Today is January 18th. I still have yet to be called. Unless they are aware that basically it's been 2 weeks for me already. But now everyone in my household's going to get tested for the next 2 days. My father just went, and then my sister's going. But, yeah, it's just, it was weird. I had to take like a 2-week hiatus. Sit in my room and do nothing. And just wait. So, yeah. That's the update. That I traveled around 27,000 kilometers in 2020. 27,000 kilometers across Ontario. Hiking, exploring different places. And the one place I catch the virus was at work. Because, you get too comfortable with people, and that's what happens. You lay your guard down for a split second, and you catch it. And I think that's the problem with the numbers spiking now. The more stuff they're closing in Ontario, the more people are creating a more comfortable bubble where they're like, okay, I see these 10 people on a daily basis. I'm comfortable with these 10 people. I've never seen them sick throughout the year. So when I see them, I don't need to wear a mask, or I don't need to stand 6 feet away, or I don't need to follow certain guidelines. And the thing is that they work. They're definitely made because they work. And, you got to wear a mask. You got to stand 6 feet apart, or you're going to be like me. You're going to get it. You're going to get... And then now my coworker ended up in the hospital because that's how bad he had it. And it's just crazy, 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 crazy world. And I believe because they have everything so closed that it's forcing people to make groups, which is like you'll have a group of 5 in your house and you get too comfortable and you're not wearing masks together in the house. You're not, you're drinking together, you're eating together, you're fucking chilling together, trying to live a little, but it's crazy. It's crazy. I traveled 27,000 fucking kilometers 2020 across Ontario. I catch it at work. Because guess what? Those places I went to all over, I had to wear a mask because they were regulated. There was people there regulating me, watching me to wear a mask. And you know what? Let my guard down for one day. And I caught it. So wear a mask, all that. That's the update. I had it. It is what it is. And hopefully I'm going to go on an adventure soon. And that's it. Peace out.